How do you empower potential? With one question: what if? What if we could reduce the number of deaths, hospital readmissions, and the total costs of healthcare associated with patient sepsis? Now, the potential of what if has become reality with a visionary new technology. According to the CDC and the Sepsis Alliance, sepsis is the leading cause of death and overall costs to hospitals annually. At least 1.7 million adults in the U.S. develop sepsis each year, and of these cases, 350,000 patients die during their hospital stay or are discharged to hospice care. The estimated cost to U.S. hospitals fighting this disease is approximately $62 billion annually and rising. A hard disease to diagnose, sepsis can be complicated, often rapidly leading to tissue damage, organ failure, or even death. Until now, mapping the progression of sepsis has been difficult. Periodic blood tests only provide a snapshot of the current disease state and doesn't necessarily reveal the trajectory of illness. Interstitial fluid provides a unique opportunity to better monitor this deadly disease. This bio-rich fluid contains over 10,000 unique compounds and biomarkers, which is free from inflammatory or immune system response and can be continuously drawn to detect the biomarkers associated with sepsis.
We generally think of bodies as made of cells, and in many places the cells are right up against each other. But for lots of places in the body, the cells aren't up against each other, and those can't be empty spaces. They have to be filled with fluid. That's the interstitial fluid. It's what fills the spaces between cells. There's all sorts of molecules passing through it. Sometimes cells are passing through it, but not as often. Cancer. We know that it spreads through blood vessels, through lymphatics, but it also turns out it spreads through the interstitial spaces, through the interstitial fluid. So it's very important for disease. Infections. There are many infections that spread through the interstitial network.
However, gaining access to this vital part of our anatomy has been incredibly complex and challenging.
What's new about our understanding of the interstitium is that it is a body-wide system that links up across all organ boundaries. And it turns out that those spaces throughout the body are 4 times the size of the cardiovascular system. So it's been difficult to access the space where you get interstitial fluid. Until recently, we didn't understand the structure. We were focused on these tiny spaces between cells or around the capillaries. We've been walking down sidewalks, and it turns out there's a superhighway we were ignoring.
Kiffik's patented breakthrough technology has solved the problem of non-invasive, continuous access to interstitial fluid. Worn for up to 14 days, this device can be useful in the continuous monitoring of lactate levels in the body, a prognostic indicator of sepsis. It can be utilized for both inpatient and outpatient use. It is compact and simple to apply to an accessible area of the body. Once connected to a smart device or linked to a network, it will start taking continuous lactate readings within a 10 to 15 minute period. The device can be fitted with a variety of sensor arrays for the detection and monitoring of all sorts of disease states. It is low profile and conforms to the wearer's body and doesn't require a health professional to apply. With an IPX6 rating, it supports ambulatory use, including showering.
If you have real-time information like a Kiffik device will offer you, you can look at early trajectories of diseases of patients when they're in the most at-risk state of their disease, which is early on with the infection.
By bringing the benefits of continuous, non-invasive, real-time monitoring of interstitial fluid to our strategic partners, we can help advance possibilities in monitoring and medicine that will accelerate the future of healthcare. And so the question becomes, what if your vision and this visionary technology came together?